Then you didn't get the whole explanation, right?
Yeah, because it was a welcome screen. Yeah, now it's
Yes.
visible.
Just check the YouTube.
Yeah. Same
That
welcome.
YouTube.
Still welcome.
It will take.
Yeah,
It will take
welcome.
15
Just
seconds. It will take. It will take 15 seconds. Check YouTube now.
yeah, it's
I will
visible now.
inform.
Yeah. So we said there was no heading here. Back pain is the main heading. Text here did not have a heading. Okay, this was typed now. You didn't see that. So what we should do? To find a heading, the clues were said. First read the topic sentence. Then you will find the subject of the topic sentence. Back pain is the main topic. Okay, main topic. And that back pain will be repeated. It usually feels like an ache. Back pain usually feels. It usually improves over a few days. It means back pain. Again, back pain, back pain. Known as non-specific back pain. Back pain is repeated 6 times. So this first part speaks about what is back pain. How do you feel? What is back pain? That's why we say it's a description. Then next paragraph you have, it starts with acute back pain. Another paragraph begins with acute, persistent or chronic back pain. So what does it mean? Yeah, there are types of back pain. So normally generally first text will be definition or description and classification. Normally, generally. So if the heading is not given, if that is not the case, heading will be given. So first business is to create the heading. Yes. Now coming to second text. We have a heading, but that doesn't comprise the whole thing. So what you have to see? You have to see the side headings, subheadings. One is clinical assessment, then management,
Investigation.
Not specific.
Investigation comes under assessment, right?
Yes, Father. Next.
Yeah. Investigation comes under assessment. Investigation comes under assessment. So you need not include that. Even here you have another subheading for acute pain, for persistent back pain, all those things. But that comes under management. So here the heading can be. What can be the heading?
Clinical management and management.
Yeah. Clinical
Assessment and management.
assessment
And management.
and management. Okay, the whole paragraph's text B speaks only about clinical assessment and management. Even you can write just assessment and management. If you can understand, that is cool. Or you can write investigate and management. This is only for your understanding. So you can write whatever you want, no issue. So heading is clinical assessment and management. You should be very thorough with these things, okay? This is very, very important. Next one is C. Again, you don't have a particular heading for the whole text. You have some subheadings. What are the subheadings?
Causes of
Causes
back pain.
and self-care.
Self-care.
Yeah, both of non-specific back pain. Causes of non-specific back pain and self-care of non-specific back pain. So the heading will be
Causes and self-care.
Causes and
self-care.
And self-care. If you want the whole thing, you can write, but not necessary. If you need, you can write causes and self-care of non-specific back pain. For your understanding sake, in the beginning, you can write also, no problem. So that is the heading. Okay. Then you have text D. Again, you don't have a particular heading for the whole text. You have some subheadings. So what is this?
Specific condition.
Yeah, actually this is a condition that cause back pain.
Back pain.
Okay, so this can be the heading because these include means specific conditions include. These means specific conditions. So that also means the same. So you can say the heading is Heading is
Conditional course.
specific conditions. How beautiful. Yes. Okay. So that is the heading. Now you have 4 headings. What you should do next?
Write down the
Yes,
top of the
write
page.
down. Yes. Write down
The top of all
4
pages.
text headings. Text A, text B, text A, definition and types, text B, assessment and management, text C, causes and self-care, text D, specific conditions. Write down the 4 headings. Okay. Now, next step, understand the sequence of 4 texts. Okay. Step 2. This is the sequence now. First text says about definition and types. Next one speaks about clinical assessment and management. And, sorry.
Causes
Next
and
one speaks about causes and self-care. There is a back pain. There is a spelling mistake, BSEK. You have to correct it. 4th one, specific conditions. Okay. There is a connection between these. Medical procedure actually has some link, right? Some connection. For example, you admit the patient, then you have investigations, then you have diagnosis, then you have medication, then you have what you call discharge or management plan, whatever. Okay. The sequence of a medical process. Just maybe something like this. You can have a better, being health professionals, you know, better sequence. Patient admission. Next step is initial assessment, right? You might ask them what is happening, all those things. 3rd step, diagnostic investigations. Based on the initial assessment, you may ask them to have the blood test or scan or whatever, X-ray or something. 4th one, clinical diagnosis. Means based on the investigations, diagnosis will be done. Then management plan will be made ready. Then treatment or interventions. Treatment also means all the interventions. It doesn't mean only the medication, even the exercise, physiotherapy, whatever. All these come under treatment, or we call it the interventions in general. Monitoring and evaluation. Monitoring and evaluation. Multidisciplinary management. If you have to refer the patient to other disciplines, that you do. 9, discharge planning. 10, follow-up. I'm just giving you, there is a link between the 4 texts. Maybe couple of these 4 or 5 or 6, sometimes 2 aspects will be in one text, sometimes one aspect. Every text will have this idea you should have. If you are confirmed of this sequence, then it becomes very easy to identify the answers. Writing the 4 text headings on top of each page of the question booklet. Very, very important. Okay. Step 3, writing these all A, B, C, D headings on each page of the question booklet, your material. Right, I'll give you a couple of seconds right now in all the pages on top, on the top corner like this. Are you all moving with me at YouTube? I can see you. Yeah. I love OET, I love Edu Skills. Nasma, that's great. Nasma Akhtar, good evening. Yes, Anila J, specific conditions. Yeah, great. Hope all of you have liked the video. If you love this, please like in the YouTube. Just like, and if you can share it to someone, please share to your groups. All are writing the 4 headings. A is definition and types, B assessment and B specific conditions. This is very, very important. On top, on the right corner of every page. Is that done? If done,
Yes,
yeah,
Father.
at YouTube, if you have done it, just message 1 heart or 1 thumbs up. Yes. Okay. Done. Okay, identify the clues in the 4 texts. Skimming. Now, next step is skimming. The actual business we have not started. Even for finding out the text headings, we have started skimming. But now we have to find out the clues to the answer in the detail. Skimming what all things you are supposed to find out. We have seen it. That is the next step. So here, what else is important? Back pain, those things we have. Sorry, that's the screen, right?
Yes, Father.
You see? Yes.
Yes, Father. Now it's this one.
Yes, Father.
Yeah.
Visible.
And I'll give you a very, very important clue. If there are pet names for any disease or any names or any condition or any types, pet means another name. One condition is known by another name. That will be normally 99% will be an answer. Okay? We'll say Mini is also known as Ammu. That could be the pet name. So they will be asking Mini is also known as Dash. So here, can you find such pet names somewhere? And emotions
No.
usually it usually feels like an ache. Feeling, emotions normally is important. Then any types are known with other names.
No,
Found for this known as
no obvious reason.
Non-specific death. Non-specific death.
Yeah. Again, the pain due to muscle, helmet, fall, or injury because of this itch in the vibrate. This commonly known as slip disc. Just I'm telling you, giving it. No other known as is given here. Two known as is given. Do you have any other known as?
Slip
Below?
disc.
Yeah. After that, in the below, do you have a pet name for the pain?
No, Father.
Chronic
back
pain include
Chronic back pain.
chronic back pain include persistent. No, it is given here. No, persistent or chronic back pain is given in the heading itself.
Heading, subheading.
Same it is, or it is given, or so it is same. So it's also another name, but it is given in the side as you begin persistent or chronic back pain. That's why they repeat people most at risk of chronic back pain. Okay, let's see. Those are the things. Now coming to text B. Okay.
Further, in the text, there are also a number 3 months that we have to note it.
Do you have a number?
Yes, Father, in
3 months.
persistent or
Okay.
chronic back pain.
Oh, that's
3
great.
months.
Yeah, 3 months. That's great. Great observation. Yes, 3 months. That's great. 3 months or longer. Any other?
Weeks or
Arthritis.
months.
Cool. We need not look for everything. You need not get everything. Just get an idea. Then coming to clinical assessment.
Age 30 or 40.
Pardon?
30 or
Any
40. Age.
30 or 40. Where is it?
In causes
Test
of
number 3.
back
3. Test.
B, I am asking B. At B, do you have some names of some instruments, some test, some diagnosis?
Yeah, X-rays, magnetic.
Yes,
Investigation,
Yeah, you have an
diagnosis.
X-ray, all of those things. Yeah.
And
So this is important, we say, right? Skimming, you have to just underline these things. Okay. Anything else?
Walking, light exercise, swimming in management.
Advise patient to keep moving, such as that can be walking. All those can be part of intervention, right? Intervention,
of
medication.
burning,
Types of
stabbing. Pain, Father.
simple
Burning,
analgesia,
stabbing.
analgesia, and anti-inflammatory medications also can be just noted.
Physiotherapist.
Yeah, physiotherapist.
Pain
Exercise,
management.
yeah, exercise,
pain management
physiotherapist,
team.
Refer to psychologist.
management team, pain management team is a name of a team is mentioned.
Tendons.
Psychologist.
Muscles and tendons.
Refer to psychologist, yeah. Okay, that's
Muscles
enough.
and tendons is a part
Yeah.
of body.
Yeah.
cognitive behavior therapy.
Which one?
Cognitive behavior.
Behavior therapy.
Yeah, we'll come back. We'll come back anyhow. We'll just showing how you can go fast. Let's see. Now causes. Do you have some numbers here? Age
30 or 40.
30, 40. Yes. And then glance through. Do you have any other important things for skimming?
Bending and lifting. And further is it
Overweight.
important?
Being overweight.
Pregnant women.
Tell me the line.
Father, fourth bullet being overweight.
Yeah, fourth bullet.
Overweight.
Lower back,
Overweight.
other joints.
1, 2, 3, 4. Long posture, residual pain. Include closing account of people. They were lifting improperly. Pregnant women are more likely to pain due to excess body weight in front and in ligaments. Ligaments. Okay, let's just keep it highlighted, no problem. Ligaments, this area. It doesn't mean whatever you highlight will be the answers. Okay, but we are closing down to the answer. Then almost everyone suffers. Learning more about. Anything else?
Exercise and steering activity.
Quitting, smoking, increases.
Relaxation technique.
Avoid
Relaxation
fatigue and
technique. Backs. To reduce stress levels and related muscle tension. Massage. Heat and cold pack. Gentle exercise. Yeah, all these interventions, right? Treatments, interventions, management. Let's see. Let's go to part B, part D.
sciatica.
Okay,
Sciatic nerve.
Sciatic nerve, yes, the body parts.
Hip and fat. Hip to fat.
Yes,
Hips to feet.
yes. Then
Hips to feet.
Slip disc.
slip disc. Yes, slip disc. Okay. Body
Manual
parts.
therapy.
With rest
Surgery.
rest gentle exercise.
Paresthesia.
Paresthesia.
Anesthesia.
Manual therapy or surgery.
Loss of control of bladder.
Painkillers.
Swelling in the back. Notice all this you can just have in your mind. There are so many swelling and other symptoms. You need not to highlight all those things.
Osteoarthritis. Spinal stenosis.
Yeah.
Osteoarthritis.
Osteoarthritis.
Vertebra.
Vertebra.
Yes. Yeah. Let's check and come back. Just to skim means just go through. Now your business is here. Okay, I have put randomly some expressions and 4 columns are there. You have to tell me first one goes to which column. What is back pain? If they ask, provided if they ask, what is back pain goes to which column? Definition.
Definition.
What is the definition? Yes. Okay. Then tests.
Medical assessment.
Assessment and management.
Investigation.
Clinical assessment. Okay. Right. Sorry. One sec. Lost that track. Where am I? One sec. Give me 1 sec. Lost the slide. Here we are. Yes. Cool. Then persistent back pain.
Definition.
Types. It is a type, right?
Types.
Yes. Then gentle exercise.
Self-care.
Self-care.
Management.
Assessment and management.
C.
Where is it?
C.
Self-care or B or C?
B.
Self-care is
Okay, let's see.
Right.
How long you will have back pain?
Definition.
How long?
Assessment.
Okay, we'll check. Then pain management team.
Management.
Management.
Yes. Already the word management is there, so immediately we should go there. MRI.
Assessment.
Investigation.
Management. Assessment and management.
Assessment.
Assessment.
Okay, assessment. Light exercise.
Management.
B. Management.
Self-care. C.
Which one? B or C?
C.
There's a doubt, B and C. We will check. Reasons.
C.
Causes. Reasons means causes. Yeah. Self-help.
Self-care.
Self-help is the synonym of. Please don't scribble on the screen. There are some newcomers, I believe. Please. It will take time for me to clean it again. Please don't scribble if you don't know. Please don't do it on the screen, okay? Lot of scribblings. Maybe some kids are there in your hand and they are doing it. Please look into it. Let them not touch the screen, okay? Lot of scribbling. And if you are not in a position to attend, you can attend at Zoom, because you see, when you do that, I lose a lot of time cleaning those things. Otherwise, yes. Now, next one, why? Why back pain?
Causes.
Causes. Why also gives reasons, right? Causes.
Yeah.
Why means causes. Then what age?
Causes.
Specific condition.
Causes.
Yeah, let's
Why?
see. Cause again.
Causes.
Massage.
Management.
Management.
Self-care.
Okay. Now check your answers with this. What is the definition? How long you had? This one is in the definition. Persistent back pain is a type of back pain. Assessment and management, usually in assessment you have tests. To manage, you will need to have gentle exercise every day. Pain management team comes to management. Light exercise, again, it's management. You had a doubt there, right? Self-care, it's not self-care. Management. Exercise is management. And MRI, again, assessment. Causes and self-care. Reasons means, again, causes. Self-help means self-care. Why means reason, again. What age? What age? Again, age is a cause, right? Old age. When you have old age, young age, it's a cause. Your age is a cause for your back pain. Cause, again, causes. Massage, again, comes under self-care. Massage is self-care. The fourth one I have not selected. I was just doing it now due to lack of time. I didn't do. Still, we will just have a look at one sec. Now you already know this one we have done last time, 20 questions we have done, so I am not going into it, but showing you that we have already done in the previous session. Reason why. I took the words from here, okay. Reason why, immediately cause. That says it comes under C. It comes under C. So immediately you can write, when you know reasons, causes, all those things, you immediately you know. Third text is on causes. So immediately C. 1 to 7, if there are newcomers, you are supposed to just write the spelling of the text. Is it A or B or C or D? Don't write this, okay? Cause and self-care, don't write that. That's not required for your understanding. I have done it here, okay? So maybe I will show it here again. Otherwise, you might make a mistake. So what you have to do? Only write C in the answer booklet. C is causes and self-care. Issues. Issues means another synonym for conditions. Conditions. Issues that may need the person to see a doctor urgently. So that is D. Specific conditions. Only The spelling will be written. Self-help strategies for people with back pain. Self-help. Which text?
Self-care.
Excuse me, Father.
Self-care.
Self-care.
Yeah, please.
Excuse me, Father.
Please.
I have question 2. Issues that may need the person to see a doctor urgently.
Yeah.
I can't get it.
You can't get it. We'll come back to that. We'll be analyzing. We'll be going into each question and paragraph. Okay. Next step.
Okay.
Now we are just trying to drill into your brain. This is the step you have to find out. Okay. Now match the text with the statement given. Okay. If you have it out, we are going back to it, and we won't believe these people who are shouting. We will check it with the paragraph. Okay, with the text. So the test. What does it say? It's from B.
Assessment.
Clinical assessment. Yeah.
B.
Now, very words tell you immediately, within fraction of seconds, you can identify the text. The pain, what back pain feels like.
A further.
Definition, because it cannot,
Types of-
yeah. Why pregnancy increases the chance of women suffering from back pain? Why?
C further.
C.
Cause.
Why? When there is why, answer will be reason or cause. Right?
Reason.
Yeah. Why? Why always gives a reason or cause. The link between spinal stenosis and back pain.
Specific condition.
Whenever there is another condition mentioned with it, it says specific conditions that lead to, then you have to read the whole heading, okay? We have written only specific conditions that lead to back pain, okay? That's it. Then we have to go to 8 to, did you understand? Only till, don't confuse, only till 1 to 7, you have to match the text with the statement. But for your practice, I always suggest at this step, you match the text with all the 20 questions. All the 20 questions. So here again, what type of back pain can be eased with gentle exercise? Since we have done last time, I am not asking you, okay? So, type means A. How long has a person been experiencing back pain if it is considered to be persistent back pain? Type, right? Type of back pain.
Yes, further.
Persistent back pain. Type. So A. What sort of pain might a person be suffering from if they are referred to a pain management team? Again, management is there. So B. Assessment and management. Now you know where you have to immediately go. You need not search all the 4 texts. Immediately you'll be going to B. Then people over what age are at higher risk of back pain? Age is we said it's a cause, right? Yeah.
Yes,
We'll be looking for a number, definitely. Yeah. What condition might a person have if they are experiencing pins and needles around their bottom?
D.
Condition. Specific condition. D. Yes. Which nerve carries information from the pelvic area of the toes?
Text D. Yeah.
Specific condition. Which nerve? They are asking for a nerve body part. Being overweight can cause back pain and place stress on what parts of the body?
Cause. C.
Cause. Already cause is there, right? Here.
Yes, further.
Can cause. And answer will be a body part.
Body part.
Which nerve? Again, a organ, body part, name of a organ. What condition? The name of a condition. What age? A number. And what sort of pain? A type of pain. Again, name. How long? Some number.
It's a number.
Okay. Yeah. And what type of back pain? Again, one type. Answer will be one type. So exactly if you see whatever we have learned in skimming and scanning, those are going to be the answers, nothing else. Okay, 8 to 14 is done. Next is, to convince you, I have included the side headings on top of every page, okay? You should have it always. Now, 15th one, over time, dash posture will raise the risk of a person developing back pain. Posture is always a cause, right? Sitting continuously, poor posture, is a cause. C.
Cause.
Massage and dash packs can ease acute back pain.
Self-care. C.
Management. Management.
Self-care.
C. Management.
It must be.
Self-care.
Management.
Yeah.
C.
Suggest B, right?
Management.
Yeah. C.
B.
B. Okay. Let's check. We'll be checking it. 17. If a person has back pain for no detectable reason, it is called dash back pain. You see, it is called dash back pain. Means
Yes, Father. A.
one pet name.
Known as. Yes.
Yeah, you should write a pet name. So it must be A, right?
Yes, Father.
Let's check. It's written B.
Here
Let's check.
this is,
Surgery or, as I said, when there is a conjunction or a list, one of them will be the answers. Is often needed if someone has a slipped disc. Again, we have highlighted slipped disc. We have already highlighted slipped disc. Yeah, 18th we will clarify. Okay, we are coming to the paragraph. Yes.
exercise management.
20th one,
Father, 18th
an
question.
X-ray. 18th will be getting back. We are coming back to you. Okay. There is a doubt
Okay.
regarding 18th one. We'll come back to as we refer.
Competitors.
And 20th one again, you have an X-ray or computerize all those names.
Investigation.
Investigation names immediately, you know. It is from B text. Okay. Do this 1 to 20. Write down there. Not just A. When you do it in the beginning stage, you write this A definition and types this way. Okay. And later in the exam, you need to write only A, B, C, or D. Is that clear? Now let's check. Now first one we said it is from text C. Reasons why of back pain. Why? We said when there is why, it should be cause, right?
Cause.
Why means for some reason, cause. So why? There is reasons why of back pain with no obvious cause develops. So where is it given? Causes of non-specific back pain. The heading itself says causes of non-specific back pain means there is no obvious cause. Okay, no self-care and non-specific back pain. So the whole thing speaks about no obvious cause. Did you understand? Here we are not supposed to find out the answer. It's only match the text, right? Where this particular why is given. So you don't require anything else. You need only the word causes, right? To identify the text. Is that clear?
Yes, Father.
Yes, only matching the heading till 1 to 7. Now even 2 is just matching the heading. Issues that may need the person to see a doctor urgently. Specific conditions. Where do you have the answer? Doctor urgently. Immediate medical
attention.
See, immediate medical attention is a synonymous of
Urgent.
see doctor urgently.
Doctor.
Yeah. So that
Father,
that
the same-
information. Pardon?
Sorry, Father. Father, the same sentence is in the text A. This is commonly known as slip disc and need immediate medical assessment.
Yeah. Issues that may need the person to see a doctor urgently. You are only supposed to say in which text this information is given. No other answer is required. No, you need to write only D. So don't worry about explanation. Immediate medical attention is required in particular issue. A slip disc. You are meaning issue says slip disc is singular and issues is plural, right? That's what you mean?
Father, in the text A, it is mentioned same only, Father. That's why.
Immediate medical assessment, the same thing they mention in text A.
Text A, do you have it?
Yes.
The
One
slip
sec, one
disc
sec.
needs immediate medical assessment.
We'll come back. Okay. Remind me when we reach text A, let me know. Okay.
Okay, Father.
Okay, Father.
Yes, yes. We'll check it. Then that is question 2. Question 3. Self-help strategies for people with back pain. As soon as you have self-help,
C.
you know, this comes from
See.
Self-care, right? Self-care. So immediately, since you have skimmed, the text heading itself says it is C. That's why we write down the heading. Even in the exam, you can write down, okay? There was some comment whether we can write. Yeah, definitely you can write on the question booklet, no issues. Then, question 4, the tests. People may have to find the cause of their back pain. Tests.
The test B further.
Yeah.
Investigation.
Investigations, right?
Investigation.
Synonym of investigations. Yeah. So B. Here, no answer is required. Just write which text contains this information. 5. Again, same. What back pain feels like? It usually feels like an ache. An ache. Yes. Then question number 6. Why pregnancy? Why again? Why means cause.
Reasons.
Yeah, pregnancy causes. So you need not read the detail because we need only in which text this information is given. Why means automatically causes. Otherwise, you have to go and read the whole thing. Now let's find where it is. Just check. Pregnant. See, pregnant woman.
1, 2, 3.
That's
Pregnant woman. Yeah. This one, right?
Woman. 6th one.
Yeah. You have the information here. That clear? But we need not locate. Once you know this strategy, you need not to search for it. Because when they say why pregnancy increases, causes of, you have cause there. Cause means why. Reason. Why means answer must be a reason, right?
Yes. Yes, Father.
Okay.
Yes, Father.
Cool. 7. Again, match the text with the information given. The link between spinal stenosis and back pain. The link between itself says specific conditions that cause back pain. The link between spinal stenosis and back pain means the heading, right? This is similar to the heading. Correct?
Yes,
Yes.
Father.
Yes.
Specific condition.
Number 8. What type of back pain can be eased with gentle exercise? What type of back pain can be eased with gentle exercise? Do you have gentle exercise here? Types: management of non-specific pain for acute pain.
Yes. Advise
acute pain.
Patient
Yeah.
to keep moving, such as
Yeah.
light exercise,
Light
swimming.
exercise.
Yes. Such as walking, light exercise, and swimming. Okay. What type then?
acute pain.
Acute.
Yeah.
Pain.
Yeah. Management of non-specific back
Acute
pain
pain.
or acute pain. Answer will be acute pain. So immediately you go there and search for the answer. Next question. 9. This is not 7. Okay. This is and. Okay. Sorry. How long has a person been experiencing back pain if it is considered to be persistent? Immediately you have to go to
Text A.
persistent. We have skimmed. Already we have skimmed. So don't read all these portions. You have to go here. How long?
3
3
months.
months.
Or longer.
3 months or longer. So immediately you have number there or a number or a period, time period. Yes. Then next question. 10th one. What sort of pain might a person be suffering from if they are referred to a pain management team? You have somewhere pain management team?
Yes.
Yeah.
Yes, Father.
Yes.
Referral to pain management team.
Refer to.
Referral to
thing
pain
is-
management.
The first thing says management word is there, so you need not look into the first portion. You have to straight away go to management portion.
Management.
Yeah, from there you have to go to which type. Okay.
Persistent.
Persistent back
pain.
Persistent.
Yeah. Exactly. Then 11. People over what age are at higher risk of back pain? What age? You are asking for a number, right?
30 or 40.
Yeah. Immediately, you have already highlighted. You have already highlighted
Number.
in skimming.
Numbers.
So you
Yes,
need not
sir.
go anywhere. Within, if at all you require to search, you can just go into when you know what age, it's a number. Immediately look for number. That is question 11. Question 12. What condition might a person have if they are experiencing pins and needles around their bottom? What condition means a name of a condition.
Condition. Pins and
Yeah.
needles.
Pins and needles. So you have to look for pins and needles. What condition? These include pins and needles. The expression is here. So paresthesia. Correct?
Yes, Father.
Bottom or gently. Yes. Then 13th one. Which nerve? Which nerve? Means again they are asking for a body part, right?
Sciatic nerve.
Yeah. Carries information from the pelvic area to the toes.
Sciatic nerve.
Yeah, sciatic nerve. Sciatic is information of the sciatic nerve which runs from hip to top, which is highlighted. Pelvic area to the toes. Yeah. Sciatic nerve.
Hips to toes. Yes.
Very beginning you have the answer. Which nerve? You have to search for a nerve. Then 14. Being overweight can cause back pain and place stress on what parts of the body? What parts? Again, they are asking for the name of a body part of the body. And can cause, this says this is in C text, right? Text C. This text C.
Yes.
Yeah. And again, what parts?
Fourth bullet
Being
point.
overweight can cause back pain and place stress on. Being overweight. Where do you have overweight?
Yeah. Three or fourth bullet point.
1, 2, 3, 4. Being overweight. Yeah, exactly. Increases stress on the being overweight.
As well as other joints.
Lower back as well as.
Other joints. Other joints.
Okay, yeah, I have missed it here, right? While typing. The joints. Okay.
Other joints.
Yes, that was a typing mistake. Yes. Right.
Back
Then
pain and
coming to 15th one.
Excuse me, Father.
Please.
In 14, we will write lower back or other joints.
the lower back
Being
is
overweight
already
can
there.
cause back pain and place stress on what parts of the body? Plural. Lower back itself
But
is singular,
causes-
right?
Okay.
What parts of the body? It should be
Plus
lower back
Other,
as well as other joints.
okay.
If it is which part of the body, it will be only lower back
Lower.
can be. But they may not ask
Okay.
there. Since they have given plural, the question is plural.
Okay.
How many? If they ask how many, you have to say many, right?
Okay.
Yeah, how many hands you have? You cannot say one. Maybe
Okay.
if they have given in the text left hand and right hand, you'll have to say two, right? Left hand and right hand. Okay. And 15, is that clear?
Yes, Father.
Yeah. And 15th one, next, one other segment, okay? Fill in the blanks. As I cautioned you in the third session, be careful about this part. Don't repeat any words. Okay? Overtime dash posture will raise the risk of a person developing back pain. You have to look for posture.
Posture.
Prolonged
Poor
poor.
posture.
Fifth
Yeah.
bullet point.
Poor posture.
Fifth bullet.
Yeah.
A
1, 2,
prolonged
3, 4. Yeah, it is a
posture.
prolonged posture.
This is a prolonged
Poor
No,
posture.
posture.
One
Poor
check.
posture.
There is some spelling mistake, type mistake. Poor is there. Yes, that was in white color. Okay. Poor posture, right?
Yes,
Poor
Father.
posture. Overtime. Overtime means prolonged. Don't write again prolonged. It will be wrong. That's what I said. Don't repeat. Overtime means prolonged. That's why I said synonyms and synonymous competencies must. Will teach you that. Same material will give you couple of other tricks. Now we are giving you blunt main surface tricks. So never write poor, overtime, prolonged poor or poor posture. Even if you write poor posture, that answer will be wrong. Because if you write overtime prolonged posture, overtime prolonged poor posture means overtime posture. And if in the answer booklet, if you write poor posture, when you fill in here, it becomes overtime poor posture. Poor posture. Doubling will be there. That answer will be wrong. Normally people do that mistake. Overtime dash posture, only poor is the answer. P-O-O-R, nothing else. Don't repeat the words. Okay? Beware of that. 16, massage and, as I said, conclude. When there is a list or conjunction, one of them is an answer. So massage and, you have to find out where is massage now. Self-care, it comes under self-care, right?
Last part.
Last one.
Yeah.
Last line.
Yeah, so self-care means you have to immediately go here, not above that. Don't look here. Causes. Where is it? Last.
Massage
Lacking.
and heat or cold back.
Yeah, massage
Last
and
line.
heat and cold.
packs.
If you write
Okay.
heat and cold packs, that is wrong. Answer is only heat and cold. If
Heat
you
or-
write answer as heat or cold packs, if you write that word packs, that's what I said in the repeatedly I am stressing it, that will be wrong. Did you understand?
Yes,
Because packs is here. When you fill in the blanks, if you say heat or cold packs, if you write in the answer, it will become, we'll have to read like this. Massage and heat and cold packs. Okay, don't repeat. It is called doubling. A mistake, doubling. Don't do the doubling.
Father,
Yeah,
we will only write heat or cold. That's it.
that's it. Exactly.
Okay.
If you write heat and cold packs, that answer will be wrong. You won't
It
get the
will
score.
be wrong.
Yeah.
Okay, Father.
And many candidates say exam was so easy. It looks easy, right? I have written heat and cold. They asked what sort of packs, massage and what packs? I have written heat and cold packs. But you are supposed to fill in the blanks. When you fill in the blanks with your answer, if that answer is kept in this blank space, that should read it as a meaningful sentence. Do I make sense?
Yes.
Yes, Father.
Yes, Father.
Yes, Father.
And you will understand now, but you will do the mistake, I tell you. So you write that hold and cold packs and cut that pack so many times, scribble it and hit it and do something of that mental psychological impact. Otherwise, you will do that mistake. I know. In spite of saying this, people do that mistake. You have to practice it. Okay?
Okay.
And it's not people have not practiced or they're not competent. These are the simple things, smart work. It is not hard work. It is smart work that counts. Okay. Question 17. If a person has back pain for no detectable reason, it is called dash back pain.
Specific.
Non-specific.
Already done.
Non-specific.
This is,
Non-specific.
as we said, this we have highlighted in skimming. It is not here in this text. Non-specific. If you write non-specific back pain, that is wrong.
Only non-specific.
Already back pain.
Non-specific.
Non-specific.
Only non-specific.
Non-specific.
But immediately you will write non-specific. You will write
Same
non-specific
copy-paste.
back pain. Pardon?
Copy paste further. Even hyphen word is there. That's why.
Yeah. So non-specific back pain. Only non-specific is the answer. Known as, called. Synonymous of called is known as. Okay. Acute, then what else? 17th, that is clear. 18th. 18th. A person with acute back pain should keep moving and include light exercise such as?
Walking and swimming.
Walking and swimming.
Swimming.
Walking, swimming.
Yeah. It comes under a person with acute back pain. Acute back pain you have here. Sorry, this should have been a subheading here. Acute back pain is here. Immediately you have to go only here, right? Because they are
Yes,
asking
sir.
about that particular type. That's how you defeat the time. You don't look for first portion at all because they are asking about one type of back pain, that is acute back pain. So you need to go only to that side heading, below that what is given. So you have, should keep moving and include light exercise and
Swimming.
Swimming and
Swimming.
walking. Yeah.
include light exercise such as swimming. Okay,
Walking,
moving,
Father.
Walking.
Father, walking.
should keep moving. What is moving? Keep moving, such as
Walk.
Walking.
advise patient to keep moving, such as walking,
Walking.
light exercise, and swimming.
Swimming.
Light exercise should not be included. Why?
Actually, the answer key is
Swimming.
walking, swimming.
There.
The answer key there says the walking
Yeah.
and swimming.
Yeah, such as walking, swimming. Because
In the-
already light
In the
exercise
question,
is
all
given.
mentioned light exercise.
Yeah, exactly. Don't repeat. Okay. Then 19th. Surgery, or again I said when there is a conjunction or a list in the text, that will be an answer. One of them
Manual
will be an
therapy.
answer. It's often needed if someone has a slip disc. Yeah.
Manual
you have
therapy.
Manual therapy. Yeah. Painkillers, but manual therapy or surgery. So you have conjunction here. So answer is manual therapy. They have just changed the order. Surgery or manual therapy or surgery. Upside down. Okay. So cool. So nice. An X-ray, again, already the answer is there.
MRI, Father.
MRI. So we have already highlighted these things, right? X-ray, while skimming, the name is highlighted, abbreviation or name. All these things were highlighted. So you have MRI here, magnetic. And there was a doubt, can we write MRI? What do you say?
Yes.
Yes.
We can.
Or should you write a magnetic resonance imaging?
Magnetic resonance imaging.
Yes, Father.
We will not
Copy
write
paste.
only MRI. It will be wrong.
No,
No,
MRI,
Father, you can write
no,
MRI.
come on. I'll distinguish. MRI is right, but then it's always safe for you to write magnetic resonance imaging, copy and paste from here, or both. MRI is right. Even if you write only MRI, don't write in brackets. Just straight away write those well-known abbreviations, which is known to everybody. Okay? BP, blood pressure. Everybody knows it, right? If only people from India know it, you can't write. If it's an internationally accepted abbreviation, you can use it. But always I say, for your safety, why don't you write copy and paste magnetic resonance imaging? That's better, right?
Okay,
Yes,
Father.
Father.
Yeah, both are right, but always I suggest you just copy and paste magnetic resonance imaging. Even if you write just MRI, that is right. If you have a shortage of time, something like that, you can do that. Okay. Now you will have at least 5 minutes extra after doing these 20 answers. So what else you can do? You can write the whole thing. So that is done. 20 answers. Cool.
Father, one more doubt,
Yes.
Father.
Yeah, please.
Magnetic resonance imaging. Okay, Father.
Tell me.
Now, magnetic resource imaging, the bracket also MRI. Together we can write, Father. Same like
You can write copy paste together, but always I suggest if you are writing magnetic resonance image, just write that. That's enough. Safe.
Okay, Father. Okay.
Even if you write both with bracket, or if you write only MRI, all these three options are right. But then the safest option is
Write the whole sentence.
all the three words. That is the safest option. Okay. That is clear, right?
Father.
Yeah.
Yes, Father.
What back pain feels like? Back pain.
It
What
feels
back
like
pain feels like means definition. How long? It's asking duration, a time. Okay? Persistent back pain is a type. Just again, I'm telling you, putting into your brain how you should do the question analysis. So immediately you know where you have to go. I'm just highlighting it. You have to practice this, particularly writing down all these things in your question booklet. Don't just say, I know it, I will do it. I should have just told you without even all these boxes and things, right? I can explain just keeping the question. But that's not enough. Okay? And name. it is called back pain. Detectable reason, it is called dash back pain. Name, a pet name or another name, I said. And there is a pet name or another name given. It's also known as, that will be the answer. And the test, clinical assessment, and gentle exercise, management, sort of pain, clinical assessment. Again, management team, the word itself is our management. Light exercise, management. List, name of a test, clinical assessment, an X-ray, MRI, CT, all those things. So, a list, name of a test, clinical assessment. When there is a list, one of them will be the answer. And coming to C, reasons why. Reasons means cause. Text C. Why means again cause. Self-help strategies for self-help again means self-help. In the C text you have self-help, self-care. Why? Again cause. Immediately you go to C. How nicely. Directly it is given almost, except only two you had doubt. Over what age a number is asked for? Again C. Cause, age is a cause. And cause, being overweight can cause. Again cause C.
Excuse me, Father.
Yeah.
In
It should be
question
both,
number
okay?
11.
There should, yeah, over what age?
Question number 11. It is
30 or
30
it should be 30 or 40. Okay,
40.
correct. You are right. 30 or
Okay, boss.
40. 30 or 40. I have corrected.
Okay.
One second. Oh, sorry, I lost it. I'll get back to it. It has to be corrected, okay? 30 or 40. Again, here there is one. Down below there is one correction, 40. And here also, before other joints, there was something. What was that? Do you remember?
Lower back as well as other joints.
Lower back.
Lower back.
Also
Oh,
left.
other joints. Okay, lower back. Yes. Yes, that is right. So you are really attending. That's great. Okay. 15th one. Posture.
Poor posture.
Yeah. Answer should be only poor, not poor posture.
Poor.
This should not be added. This should not be added in your answer. And poor posture. This one, massage, comes under self-care, management C. Massage and again a list. Then D, issues, condition. Spinal stenosis and back pain, conditions that cause back pain. That is text D, other conditions. What condition? Conditions that cause back pain, again D. Which nerve, body part D, sciatica. There is a spelling mistake, okay? Sciatica. Okay? Even if you write sciatica now, in this case it is right. Why? This is not fill in the blanks. This is not fill in the blanks. It is a question. So you can write sciatica now. Surgery or list D. Surgery or manual therapy. That's a list or conjunction. One second. Hope that is clear. I have some problem sharing the screen. Okay. Right. You have any clarifications on anything?
Father, about the text A.
Second
Father,
question.
question number 9.
Which was the question? Text A.
The second one. The second question. Issue that may need the person to see a doctor. It's mentioned text D also in text A.
Text A, where do you have it?
Text A.
This
In
is
the
text A.
8th sentence.
One sec, one sec.
Sentence.
Last line.
Can you see my screen?
Yes, Father.
Yes,
Okay,
Father.
okay. Where you have?
The
Acute
acute pain
pain
last line.
And then second
Last line.
paragraph,
This-
last line.
This is normally accepted and needs immediate medical assessment. What was the question? Do you remember? Just read the question if you have.
Issue
hard
that
copy.
may need the
Issue that may need the
Persons
medical.
to see
To
doctor
see doctor
urgently.
urgently. Question number
Second.
Two.
Two.
2. Okay, even the answer key gives D. Let's check. Answer key is giving D here. Is the answer key. Let's check. Read the question one more time.
Issue that may need the person to see doctor urgently.
Urgent.
The keyword is issue. That's why we can go D. That is the ninth.
Commonly known as slip disc and needs immediate medical assessment. I don't know, as health professionals tell me, medical assessment, does it involve doctor?
Yes, Father.
Medical assessment, does it really mean doctor is mandatory there for a medical assessment? Or do the nurse in charges do? Or some other special health professionals can do it? I don't know. You are the health professional since there is a route race, but the key gives us D, okay? But I am trying to, let's just.
Father, the issues means that one we can, the headline itself is condition. That's why we can go to the D. That's why.
One sec. Copy. One sec. I am copying it. Where was it? Question was? You said again in D we have it, right?
Yes.
Yes, Father.
Yes.
One sec. Let's correct it. Let's check it. In D we have it. Immediate medical attention. I'll just paste the other one also here, just to compare, okay? Linguistic study we will do. This is from text A, okay?
Yes, Father.
This does not belong to this particular text. This is from A. Okay. And question, tell me the question. Question number?
Two.
Second. Two.
Second, okay. Let me copy the question as well.
Issues.
Let's check. That is a good idea. Good. This one discussion. Okay, let's see. We are sure about the answer key. Answer key says D, but then let's check why this is so. This is the question.
Question is for issues.
Issue. That way we can go to the D.
Issues.
Yeah, issues.
That means following the slip disc. There are many issues mentioned in the test D.
Okay, test D speaks about issues. Yeah. No, I have no doubt it is D. One thing is specific conditions. Conditions means issues that may need the person. Needs. See, those advanced students should know this. Okay, we will be teaching you this. That's why I wrote it here. This you are going little advanced than me. May need and needs. That's, as I said, model verb.
Yes, Father.
Here, that need immediate medication.
May need. Yes, Father.
Yeah. This is what I said. You should know the modal verbs. Question says
May need.
May need.
May
Whereas,
need. May need.
yeah. And immediate medical attention. The medical attention. Need immediate medical attention. This is commonly known as a slip disc and needs immediate medical assessment. Medical assessment, what does it mean? Does it require this one? Don't worry about this doubt, okay? I'll be teaching that in model verbs. Medical assessment, does it mean? I don't know. I'm asking a general question.
Assessment means different than attention. Attention
medical
means
attention.
the person has to be immediately seen by a doctor. Assessment means you have to go through his medical details, history, and you have to assess him for why the disc why does he have the plain disc? What are the reasons? So there is many things in assessment than attention. So there is a difference there.
Okay. So what do you think here? First one is, this is normally slip disc. A slip disc can cause issues that need immediate medical attention. This is again commonly known as slip disc. Both are slip disc, right?
Yes,
Yeah.
Father. Specific condition.
Yes, Father. But issues mentioned, including
See here, issues. This is
can't urinate, pyrex,
This
like
is-
that. Some issues mentioned, Father.
issues is plural, but in that text A, slip disc is
Acute pain.
Singular.
singular. And the question is asking issues, plural.
Issues.
That will be another criteria we will be learning later on, where especially in the D and B and C also you require.
Issues.
So is it
Because
same? Issue and issues, is it same?
Yeah, the actually the issues means we
Many-
once it
many
happened, the
issues.
slip disc happened, the following that we experienced this of different problems.
Yes.
Okay, issues. Now the question is speaking about issue or issues?
Issues, Father.
Issues.
Singular
Issues.
word, plural, we can.
Where it is given, issues is given in A statement or B
Text
statement? D statement.
D.
And the question as well.
D.
D.
Yeah, question. So A is not the answer. Is that clear?
Okay, sir.
Yes.
Yes, Father.
Yeah,
Yes, Father.
issues. So this is what called smart work. There is nothing hard work here. You should be very cautious when they speak of one issue and many issues. She is having many issues. Health issues means not one issue, right? Slip disc can be one of those many issues. Does it make sense?
Yes, Father.
Yes, Father.
Yes, Father.
Yeah, this is the real way to study, okay?
Thank you, Father.
Yeah, that's what I want you to ask and discuss in the platform, Telegram group, main Telegram group. Whenever there is a doubt,
Father.
simply ask. You can counter me,
Father,
question
one-
me, no issues. I can also make mistakes, no
Father.
issues.
Father,
Please.
One more
question number
doubt.
9.
Which
Nice,
one?
Father. Question number 9.
Question number 9.
9 is here. Where is it? 9 is. How long
3
has a
months.
person been experiencing back pain if it is considered to be persistent? 3 months?
Or
months
longer.
or long.
We
Or
have to
longer.
see
Or
2
longer.
months or longer.
Or longer, probably. Let me check. Question number 9, right?
But the question
Father.
is saying that how long. So you don't need to write
How
like the
long?
all longer, because everybody's asking in the comment space. Like there is another question with the like the 30 or 40. So you need to go with the like the lower number.
Now, how long has a person been experiencing back pain if it is considered to be persistent? For example, I'll tell you like this. Now, maybe your hospital needs 2 years or more experience to make you
Yeah, so
permanent.
minimum is 2 years.
Yeah. Now, I'm just telling you, your hospital requires 2 years or more experience to make you a permanent staff. Or imagine you to promote you into a nurse in charge post. So the question is, how long you require nursing experience to be promoted to be a nurse in charge or to be made permanent? How long you require? 2 years.
2 years.
2 years, right?
Yes, Father.
Yes, Father.
Or longer. They said if you have more, it is not a disqualification. But how long you require?
2
2
years.
years.
2 years.
Yes.
2 years.
Did you get it?
Yes,
Yes,
Father.
Father.
Yeah,
Yes, Father.
exactly. For example, you need to be 21 years to get married. And the text says you need to be 21 or more above to get married. So what is the
21.
marriageable age?
Okay, Father.
21.
21.
21.
Yeah, that is
21.
simple technicality of the language. This is what I said. You will get this competence as you go on. We will give you all the tricks of OET. Don't worry. Provided you have patience.
Thank you, Father.
Thank you,
And
Father.
when I have taken to collect all those notices and paste it and put it in order and put all the tasks, add to that, and I took hours to set it right, you do not know how many videos are there, not even the number. Okay, that's not fair. Every video which is given there, there should be a comment at the YouTube comment space. You know, I have answered all your comments, right? All your comments I answer.
Yes.
Lakhs of comments, every comment I have answered. Okay, so that is easy for me to find your response. And make sure that you give the registration number in the very beginning, okay?
Okay.
Not at the end of the comment, at the very beginning. I don't say you have to give the whole experience there, learning experience, but at least include I love EduSkills OET. Include EduSkills because that helps to reach us to more people. I love EduSkills OET. Then if you want to share one learning, that will be great. There are people who have shared their experience in this platform live saying that I could not attend any sessions, but I watched videos and read all the comments. All the comments. And many comments were very useful for understanding the videos. Okay? So you can help in that way. You can also, please add people to the main platform, or like you can send me the contacts. I can reach them out as well. Let's reach to maximum people. It's not a business, you know. It's free. When I am spending so much time, maximum people will benefit from such efforts. Any admins, please have a glance at the comment space, YouTube comment space, if you have any. I can't see here when I'm screen. Any other? Can I close the screen and go into Q&A?
Yeah. One more question, Father.
Please.
Question number 11.
Question number? Question number?
Question 1 is one is asked about the doubt.
Question 1.
Yes.
Reasons why back pain with no obvious cause develops. They're asking in which text it is there. Reason and why says it is in C. You want to check it?
Father, somebody is asking in the comment space. Father,
Okay.
I have one confusion. Number 1 is the answer is C, but why not A? Because text A, there is clearly written that sentence.
Reasons why of back pain with no obvious cause develops. It can never be written in part A. I'll check it. Reasons why of back pain with no obvious cause develops. So why it develops? There's a reason given, right? Reason must be given. Cause must be mentioned. Let me check. Text A. Do you have that?
If no obvious reason is found for the back pain, it is known as non-specific back pain.
No. That is, what is the name of the back pain which develops without any specific reason? Correct. This one you mean?
Meaning is
no
different.
obvious reason is found for the back pain. This is known as null, means the name of it. But question number 1 is asking what?
Reason.
Reason.
Why?
Why?
Yeah.
Okay, and you know, when you have reason or why, you have both here, right? Reason and why. If you have reason or why, definitely that goes under causes or reasons. Third one. So here they are asking why back pain with no obvious cause develops. They are asking for reason. There in text A, they are saying what is the another name, pet name of that particular back pain, which develops without reason. Did you understand?
Yes. Okay.
Clear, no?
Yes.
Yeah.
Yeah,
Father, question number 12.
Yeah.
In 12, answer sheet, we got answer paresthesia, but in answer sheet they provide slip disc, which is the correct answer.
One second. Let me check.
Disc.
Which question?
12.
Number 12.
Right. Number 12. Which text?
D.
Just D father answer.
The answer
B or D?
But
D for dog.
D for
Yes,
dog.
father.
Okay. Slip disc. Let's check.
Father?
Question number
12.
12.
12.
Yeah.
One sec. I'll come to 12. Yeah. This is here. Surgery 12.
What condition? Paresthesia is not condition.
Father,
Yeah.
paresthesia is a symptom.
That's issue.
Okay. Yeah, paresthesia is not a condition.
It's a
Yes,
Slip
father.
disc is the
Slip disc
issue.
is a condition.
One sec. Slip disc can
These-
cause issues that need immediate. Okay, it is slip disc, correct?
Yeah.
Because
Thank you,
they are
Father.
asking for a condition, right?
Yes.
Yes, father.
Exactly. You're right. That's how you have to raise your objections. Because when we discuss, we can go wrong. Yes. Paresthesia is not a condition. You agree?
Yes, father.
Yes, Father.
Yeah, father.
Yeah. That's a symptom
you,
like
Father.
tingling, pins and needles, numbness, all those things. One of the symptoms, right?
Yeah.
Yes, father.
Yeah.
The issue.
So slip disc is the answer. You're right, ma. Whoever asked it.
Thank you, Father.
Yes. That's how you have
Father,
to
I have one
immediately.
more doubt, father.
Yeah.
For the question number 11,
Doubt. Yeah. Question number 11.
30 or 40. The
30
answer
is cool,
for
right?
30.
not 40.
People
30 or
over what age are at higher risk of back pain? Over 30. Over is there already, right? People over. Over is given here. Over
Yes,
30.
father.
But in the
But we are
paragraph,
asking
over
30 or
30 or 40.
Yeah, that's what I'm saying. People over what age means over 30.
Okay.
30 or over also may be right, but then here over is already here in the question.
Okay.
It's like what test you have to conduct, blood test or blood. But since it is not filled the blanks, you can 30 or over you can write. You want to confirm it with the answer key? Which question number?
Answer key only 30.
30, yeah.
Answer key
30
only
is cool. 30 is cool because that is understood there. People over what age? If they are asking people of what age, it should be 30 or over. When they already asked people over what age? Did you understand? Who asked
Yes,
it?
father.
Yes, father. Clear. Or I think there is a need to write 30 or 40 in.
Yeah, Ambali, you are a Malayali, right?
Yeah. Yes,
എത്ര
sir.
പ്രായത്തിന് മുകളിലുള്ളവരാണ് ചോദ്യം? 30.
30.
30ന് മുകളിലുള്ളവർക്ക് പറയേണ്ട ആവശ്യമില്ല പിന്നെ.
അല്ല 40.
Right. Okay. 30 or 40 means over. 30 is always, 40 is always over. Over. Yeah.
Okay, father. Thank you, sir.
Welcome.
Father,
Anything
8th
else?
question, father.
8th question.
What type of back pain? I can write acute pain. It is okay, or acute only need to write, father? It is question type. Yeah.
Question type, you can write both. But acute
okay,
also
father.
is right. 8th question, right? 8th question, one check. Where is it? One check. Let me check. 8 is here. What type of back pain can be eased with gentle exercise? Acute is right. Even if you write acute back pain, there is no issue. Since this is not filling the blanks. Did you understand the reason?
Yes, father. Yes.
Yeah. If it is fill in the blanks, that will be wrong. If the back pain is already given there. Acute, even if you write just acute, that is right.
Or father, if we write acute pain, say all right or not?
Acute pain, what type of back pain? Acute pain is not a good option. Acute pain means something else. Acute back pain. If you are writing back pain, only the pain don't write. Acute back pain. Acute pain can mean anything, right? Need not be connected with the back. So
father,
acute is cool, otherwise acute back pain.
Okay, father.
Okay. Anything else? So you are really, your brain is really working. That's good.
Same like that at number 10 also, father. Persistent
Huh?
back pain also we can write, or persistent also is correct.
Persistent
Okay.
is cool, but you can write persistent. Back pain also you can
also.
write, but persistent is more than enough. What sort
Yes,
of
okay.
pain? Persistent pain.
Okay, Father.
Okay, here
Thank
they are
you.
not asking about back pain, it's asking about pain. What sort of pain? Persistent pain.
Okay, Father.
Yeah, persistent is cool. See, walking and swimming, we had it out there, right?
Yes, Father.
Light exercise is given here, walking and swimming should be written. If you write walking, light exercise, and swimming, it will be wrong.
No.
Okay. Yes. And this 18 type of questions will be there in all the question papers, okay? And all these strategies will come repeatedly, nothing special. That's why I have again taken back pain, because many were asking, will it be discussed? And the admins also suggested people want it to be discussed again. Anything else?
Clear, Father. Now.
Yeah. Shall I stop sharing the screen?
Walking, light exercise, swimming.
Thank you, Father. Today's session was so knowledgeable and helps me to choose the right answer. Thank you. You're welcome, Asha Shinam. Yes. And those of you who are from UK, please message me today itself. We will find out if possible a convenient slot for you. UK people, you can connect. Those who are in the list, you can connect and send me a message, or you can contact Himani.
Okay, Father.
Yeah, those who are from UK, because their time schedule is difficult for them. This time is neither day or nor duty.
Time
Matwala, that will be separate for UK people, because for them it's a real genuine concern, because even day duty people cannot attend, or night duty people cannot. Both teams cannot attend at this time. This time will be permanent, but there will be possibly they are asking for a session at 11 o'clock midnight for me. Let's try sometimes, at least, but not always.
Father, main group mention cheyda madi oda
Personally mention cheyana. Main group mention cheyda, if somebody can collect
send the
and
personal message, please, because like it's really hard to go through with all the messages.
Yeah, if you can just type Himani Patel in Telegram chat, you can send her a personal message. Okay. Then she will intimate to me. Himani Patel, you can just type the name in the search bar. Himani, same name, right, in your Telegram?
Yeah, it's the same.
Himani Patel. Yes.
Thank you.
Himani Patel is not smiling these days, right? Once she was elevated to adminship, she became very serious. Because a lot of somebody decided to look, because a lot of work maybe here. And at time, now it is almost, what time is there?
It's 8 o'clock in the morning.
In the morning, 8 o'clock. Okay. So she got up very early in the morning.
Yeah, I am up from 4 o'clock. So
4 o'clock. Yeah, definitely we can understand it's not that easy. See, you must learn from them. Now they have passed the OET, and now they are getting up at 4 o'clock early morning to help you. But the learners are looking for convenient timings at their own choice, without losing their sleep, without sacrificing anything. And very cool, they will say, Father can sacrifice the sleep.
Oh.
Yes, that is great. Anyhow, we enjoy all those things. Anything else?
Father will always ready to help others.
Not always. I am getting old now. Earlier, I was doing it any time. I was almost sleeping 3 hours a day for last maybe 20 years. I've never slept more than 4 hours a day. But then now
you are the one
old,
who can do that one, not us.
No, I decided so when I was in the first year degree, when I was a student first year degree. After that, nearly 25 years, I kept up that decision. Even that was not sufficient. 20 hours were not sufficient for me to manage. No, I think if you go in this same rate without supporting me, I'll have to again lose sleep. Now I can't sleep because I am diabetic. More than 2 decades now. If I run short of sleep, my doctor will be angry with me. Otherwise, I don't mind.
Yeah, Father, you need to take care. So
Yeah. 56, right? So almost retirement age. So need some rest and all those things. Any other comments at YouTube comments, please? Somebody can share if you find something. Anybody wants to come to Zoom to ask some questions or discuss something? I love Edu Skills OET. And please see that you like the videos. Okay, if you like. If you don't like, there is another button, dislike button. You can plus at least one, either this or that. If you like, admin team and father really very okay. Very, very supportive. Okay, admin team and father is very, very supportive. Yes. That is great. And the problem is people don't feel serious. That's why again I sat together. It took a lot of time for me to collect all the notices and tasks and post it in one. Those things you repost. Okay, anybody who finds it, repost and mention this is going to be very useful or something like that, because maybe some beginners may not understand what it is. Some of them are frightened of clicking such files, it seems, thinking that spammers are there.
Okay, whoever is mentioning in the YouTube comment space that they are not allowed to join the Zoom today, the reason we already said that follow the father's notice. Please, father have already put the notice that you have to comment in the YouTube comment space that you want to join through the Zoom. So we'll collect your name and we'll join you here. And another thing, your Zoom name should be with your name or your registered number.
Yeah. At the YouTube comment space, if you don't want to reveal your number, you can just put your register number, no problem. Why? Because we want to know how many of you are willing to enter Zoom, because those who are working on duty cannot enter Zoom, right? So we have limited slots, only 100 slots at Zoom. So that's why we keep both live, and this is not easy. It's again a Herculean task with all the network issues, everything. If it is Zoom, we don't have that issue. But then we keep it because we are not able to admit everybody here. So please go and mention. When you mention, you have to click the like button and mention. Okay. Mention just Z. I said just mention Z. Respecting you, I said don't try, even if you don't have time to write Zoom, ZOOM. I said at least type Z. Okay. I love EduSkills OET Z. And admins have to, they need to collect those names, then admit you. It takes time. So do it at the earliest. As soon as the link is posted, if you see, immediately do it. If you are willing to join Zoom, we'll admit you. Okay. Thank you so much. Yes, Anita Taj. Yeah, Anita Taj is a very active member supporting the platform, collecting the names and whatever support is asked. I thought Anita will be here in Zoom. Yes, thank you, Father, for this wonderful session. Yes. Manju Shibu is mentioning, please click the like button. Did you all click? I don't know. I can't see how many likes are there.
Only 35 like, Father.
Oh, my goodness. Out of 470 people who joined, 35 likes. See how conjuice and stingy you are.
Everybody wants strategies, tips, but
no, I
they
think
don't want
people. No, if this is the case, I feel people don't like my sessions, so I will stop sessions, because out of 470 who attended, only 35 liked it. Which means 90% don't like my sessions. All right? See, even at Zoom, there were so many people. They also did not like, right?
I liked already.
Yeah.
Then.
If there are no 200 likes, next session will be minimum 200 likes, 470. I'm asking 1/3. If there are no 200 likes, it's understood. Next session is cancelled. Okay, let's see.
Father,
Next
next
session
time
stands
starting
cancelled.
itself. Yes, Father, next section starting itself, we will tell
Don't
them
ask
to
me
do
why
it.
there is no session. If there are if there aren't at least 200 likes for this session, next session stands cancelled. And this will apply to every session. Yes. Anything else?
Himani Telegram.
If anyone wants to join Zoom, you can let me know in the comment space. I'll allow you. Okay. Come on. Did somebody ask me something?
Yeah, Himani Telegram or this. Himani Patel 111, and there are two Himani Patel.
No, it's just Himani Patel.
No,
It's
111.
Just Himani Patel.
Yeah, since we have only one Himani Patel, we have put only Himani Patel. No 1111.
3 Himani Patel. That's right.
Yeah.
Okay.
She was our loving mother figure. Since she got up at 4 o'clock, she is not that loving and.
Yeah. Plus 3 Himani. Plus
no, Father.
Yeah, she's struggling a lot to put the batch into action.
Yeah,
She almost
so
responds to
serious.
she almost looks into every response of the batch members in the main platform. Yes. How to convince people that they should be serious, I don't know.
Father, can we join? Like there is 2 people are in the waiting room. Can we join them?
Please. Yeah. You can join, okay. If somebody wants to join, you can join now. No problem. You can admit. Yes.
Father, can we join? Like there is 2 people.
Yeah, they are already in, right? I admitted them.
Yeah, I just joined them.
Yeah. Both of us clicked. So I got one and you got one. Now, whom did they thank? You or me for admitting that? Yes.
Yeah, Joshna, you are asking at the main platform that you didn't join because you don't have the registered number. But it's not about the registration number, but you didn't commented in the YouTube like the chat box. That's why you were not able to join the Zoom session.
And those of you who don't have the Zoom registration number, please message directly to Himani Patel. She will give you registration number. And mention your registration number everywhere at the beginning. Even if you send me a personal message, when you mention your registration number, I'll be serious answering you. Because I know you are your official learner. Otherwise, every day I'll get at least some 15,000 plus messages, both in WhatsApp and Telegram. I will never be able to answer all those texts. Yes. Anything else? Anybody wants to clarify or discuss or? No smiles. Mukta is here. Yes. Anita Thad is here. Today not on duty. Yes.
My father.
Yes. You
No,
wanted to say something, right?
I came
Other day, yes. You can speak now. Other day you got disconnected when you were speaking something, right?
no issues, father. I just asked daughter, but today actually I came late. I mean, at 4 o'clock I tried to join Zoom. I mean, here 4 o'clock. So 5:30 IST I tried to join, but maybe you were, we were discussing very seriously, so I did not want to disturb. So I continued in YouTube.
Right.
It was very, very excellent. Very, thank you so much, father.
Yeah, actually, when we see active members, we don't feel disturbed. We feel happy even if they come anytime. Like we know that they are serious. Yes. Yeah. She is a veteran in watching videos and learning. So you can guide others how to be done. You are doing it exactly what should be done. Yeah, I can make out from your
Father,
notes and other things.
actually, when we, as you always say, when we listen and when we, the questions, when you discuss and explanation, even Arya ma'am and many of your students, when you are explaining, we feel like, oh my God, it's so easy. But, we wish it should happen when we attend our exam, or our, not exam, when we do that. The questions in the same way. When you do, we feel so easy. Thank you so much, Father.
And many of them who have followed the guidelines, so many of them have taken sessions. You can see now in my chat platform like Arya and others, so many of them. Almost everybody, like active learners, have taken at least one session. And it's like for them, they are like simple for them, for Arya and all. Initially, many of them had appeared many times earlier before joining EduSkills. But then once they got the trips, it's cool for them. Like majority of them have done before 10 minutes. Completed before 10 minutes, never after 10 minutes, 7 minutes, 8 minutes, and they got full marks in part A. That is true because it happens, but only by patience. You need patience and practice gradually, step by step. Skill has to be gradually developed. Nobody can give you. Yeah. Basic thing is you have to fall in love with the whole thing. No?
Yes, Father. Now I'm in love.
Yeah, I can make out.
So
I
much,
know that.
Father.
Yes,
Thank
I
you.
know that. Yes, that's great. Yes. Anyone else wants to share anything? Even in the platforms, you try to share, okay, so that others, maybe some beginners will come in any time. They will be totally confused. So every day there are new beginners coming in. When you say welcome message, there is somebody new, right? You can even welcome them. Anybody who is seeing a welcome message, automated welcome message by the platform, you can also personally welcome them if you are free and if you are visiting the platform that time. Because, so many people are finding like they are struggling like anything. What do you mean? Like because of stress, emotional stress, financial problems, and they will be like nowhere, come with lot of struggles. So maybe your one message will strengthen them. No? And if you support that way, I will be relieved of my work answering all of them. So many messages, spending so much time on that, which you can do, which many admins are doing now. But then still others also can join us. Anyone else wants to share anything or give any tips to others, your colleagues? See, you're all health professionals. I am not. So you'll be able to say better. Maybe I think Dr. Noor or somebody was there who could explain the things from a very different context, from the medical context. She used to help some people to visualize things.
Dr. Neelu.
Neelu, right? Dr. Neelu, yeah. She passed, yeah. So I can't do that because I haven't got any idea about your medical profession. Okay. But then it's good to read so many things, good knowledge. When you are in that profession, all these OET materials, the authentic knowledge you gain because from medical journals, right? Texts. Yes. Neetu, Joy, very serious.
The father.
Yes. Shah Bharatiyam is serious. Yes. Sneha Usep, Manisha, Billy, Edu 21, you are not seen. Jyoti Renita, Anita Muslim, Mukta,
Good
yes.
evening, Father. Thank you for
Good
adding me
evening.
at the end of the section.
Now you came
But
now,
I was
right?
watching. I watch your.
YouTube.
Yeah, I was watching the YouTube.
Yeah.
Very
That
useful.
you're most
Every
welcome.
day increasing the percentage of love to fall in love in OET.
Yeah.
Thank you so
That's the
much.
best. That's the
God
best
bless you.
solution and best medicine. The biggest hurdle is people hate OET, then they want good score. If you hate somebody, how can you expect something back? Good things. Right? There are people even in the YouTube comment space, you can see, Father, I love Edu Skills, but not OET. There are also messages that I am trying to fall in love. But you can. Ultimately, OET will change your life, right? I have seen so many of them who are financially struggling, Have done great. Jyoti Ranita's junior Jyoti Ranita. What's your name? Yeah. You are muted. Mommy has muted you. Yeah, there are one, two more. Yeah. Yes. Parvesh, great name. And your brother, hi, what's your name?
Tanishka.
Tanishka, great, nice seeing you. Do well, yes. Yes. And I have seen people who, without any basic knowledge, scoring A grade in OET. Those who are really frightened of English but had no idea about English, they don't want to speak English, but then scored A. Many of them I know. Provided you go step by step, it's very hard to carry people along with batch. And you can see maybe not even 15 of them are doing the task regularly. Then how can I take them around? That's why again I posted in the draft, in one single draft, all the things. Date-wise, day-wise, video number, day number. Yes. Anita Mercelin's daughter, yes. Good. Great doing. Keep doing, and please do type at comment space. You love EduSkills OET. More you type, more you say, more you feel, you will fall in love with if you have difficulty. Yes, I lost my problem.
Thank you. Today is our first class,
Thank you,
like real-time Zoom class, and it was a very useful class, Father, for us.
Okay.
Thank you
This
so much.
first session for you?
Yes, Father.
Okay, you'll have to watch the other 4 sessions, okay? Otherwise, you may not get ideas
I'm
once we
doing
go
it,
on.
Father, one by one, because I told you I have 4
Yeah.
children to take care. These twins are today with
Okay.
me home, and other 2 are
I
in
know.
school. So.
I know. But then gradually watch, okay? Because otherwise you won't understand when we say skimming, scanning, and all that.
Yes,
You may
Father.
not understand why we highlighted those words, why only those words. And there was some question telling that if there are 4 names, okay, there will be 4 names of medicine. Imagine, for example, we are saying there are 4, so maybe Himani, Ambuli, and Shirley, 3 are mentioned in the text. And the question is asking, Himani, did Himani undergo the surgery the same day? So you have to look, when you skim, you have highlighted all the 3 names. When you read the question mentions Himani's name. So where you have to go immediately to Himani's name. And the text says Himani underwent surgery the following day. Is it the same day? No, the following day. So that is the difference between skimming and scanning. Skimming, you highlight, maybe you glance through all the main points, clues. But when you go to the question, you know specifically you have to see something. So you just go and scan to find that particular specific information in that text. That narrows down you to that particular area. And we have done it today. I don't know the authenticity of this material, but it looks okay. I'm in search of new materials. I have done a lot of materials, so I don't know which I have not done. So when I asked for this material, admins also said that we have never heard of it. So I thought I know it's a new one for our platform. So only Imani had that material, I believe. Yes.
Yeah, Father, that that Anju, she was my
Yeah.
learning partner. She sent me that
Okay.
material. Like that material is like something, I think it's a 10 or 11 different material.
Okay.
And that's a new one. Like I
Yeah,
don't think so we have that one.
definitely I have more than 700 reading materials, but out of which more than nearly 500 are unauthentic materials. It takes a lot of time to find authentic materials. During Corona, so much of unauthentic materials have come to the platform, social media, where you don't find the strategies over there.
Father, I have a question.
Yes.
I bought a book from Amazon, that BMax reading. Is it authentic? Like, I will show you if you want. Because I'm trying to do that at home when this OET reading.
Who is the author?
Author it's from BMax and it's here only Team BMax. It's written.
I can't. I don't know, ma. So I can't say the authenticity. BMax doesn't mean anything. If it's from Cambridge or OET, that will be authentic. Definitely it will be authentic if it's from Cambridge or OET.
It's written professional in India and for Middle East.
I have no idea. First time I'm hearing that. And
that should be somebody's, like, the author's name.
Yeah.
No, it's BMax Academy is unique venture established in 2014 with its head office in Mevaram, Kollam, Kerala, and
Oh,
Francisco.
no.
Yeah, it's from the academy.
Yeah, it is from the academy, which I can't assure. If it's from Cambridge or OET, definitely they are authentic.
Yeah, it's BMax Academy.
Academy, no. Cambridge or OET Academy, so many academies are there. Yeah, it's okay. It's okay. I don't know. I can't assure you whether it is, because I have never come across that name. No. As far as otherwise, I haven't seen any authentic materials. I have seen so many textbooks. Many have asked me which is which. And it's like out of that 700, if I said I have collection of more than 700, 500 are unauthentic. And we have enough ample material, okay? Ample material, more than enough materials, authentic materials. Maybe 10 times more than you require. Now we are trying to put it into an ebook, but we are just waiting for some people to help us with the production cost, not anything else. We'll be giving it free, lifelong free copies so that everybody uses it. All the explanations with authentic materials, all possible needed authentic materials. As of now, for this batch, if people support us in whatever ways we can, not me, we don't accept it, but those who are producing it, the technical people, the wages have to be paid, then we will, for this batch, we are thinking of putting into 3-4 volumes, small volumes. As it is ready, we will pass it on. And free copies will be published when the whole work is done. And that may run into some at least 3,000 pages, all the 4 modules, with all materials possible. And at least some full materials, 100 full materials explained with explanations and details and video links. Let's see how it goes. Yeah. Cool then. Now I will stop the live stream at YouTube. Come everybody, bye. Nice being with you. We'll get back.
Thank you, Father.
And
Thank you, Father.
Yeah, one sec. I'm coming back to Zoom. One sec. Give me one sec. One sec.
Somebody is asking in the YouTube when the ebook will be available.
That's what I'm saying. It has to be worked out. It has to be organized, edited, compiled. There are 2-3 people working behind it. They have to be paid, so need some support. Until then, cost of production has to be paid. Then only the things will be ready. But whatever is ready, we will try to reach out. But then the free copies we'll be able to give when the whole work is done. Until then, we'll check out. We are thinking of doing it at the earliest. You know what is the chat rate in YouTube? 523 people viewed, and chat rate is 2, which means it will never reach people. 2%. Yeah. We will end at YouTube. We are ending the YouTube live. Bye. Meet you again. God bless you. Come to the Telegram group and share one learning at least. Doesn't mean that you have to elaborate the whole thing, but one new learning, what you learned today, something that you loved. If everybody shares it, those who could not attend the session will get every lesson. Yes.
Thank you, Father.
Nice.